In this video, you will see how to use the MyLabs AI app on a cancer-related lab report. Please look and listen.
Now, today we're going to be demonstrating the application of the My AI Labs app to this lab result from the Dr. Balwant Singh Hospital for a patient, with the patient's consent, who had a test for breast cancer. And this was a 4-page result that was printed by the hospital. I just showed you page 1, this is page 2, this is page 3, this is page 4. So what I've done is upload each of the pages, the entire report, to the My Labs AI app. And so the patient was able to ask the AI to please explain the most important findings in my lab result attached. Explain in easy to understand words, and also give me some recommendations about how I can remain healthy and beat breast cancer. Right? So that's what the patient was able to ask the AI for, to not just explain the report, but also to give her some tips about how she can remain healthy, become a cancer survivor, and also beat breast cancer. So the AI has a lot of work to do to answer all those questions. So let's give it some time to complete this generation. It's not completed. It looks complete now, so let's go from the top and see what the AI has to say to her. So this patient had to wait over 3 to 5 days for her follow-up visit with the doctor, even though she had this report already printed. So the patient now was able to use the My Labs AI to understand the report that was given to her by the doctor. And so when she went back, she will now be able to have a more informed conversation with the doctor about what really is going on in the report. So the report said, summary of explanation of findings, and please forgive me for mispronouncing some of these words. Histopathology Diagnostic Report, first image. Specimen mastectomy, clinical history, left breast DCIS, ductal carcinoma in situ, is a non-invasive breast cancer. Right, so the patient knows what she has. Gross description, the mastectomy sample includes the left breast with a lesion which is 7 cm in diameter. 13 lymph nodes were observed, with the largest being 2 cm in diameter. 2. Histopathology Diagnostic Report, the second image. What does that show? So from the whole first sheet of paper, the first print, what she learned is that she has DCIS, ductal carcinoma in situ, which is a non-invasive form of breast cancer. Right? And it also says the tissue that was looked at. The second image, right? It is total mastectomy, specimen lateral left, tumor type, invasive carcinoma of no special type, ductal. Right? So that's a description of the left breast that had the mastectomy or the surgery. The tumor size, the breast cancer tumor size, was 7 cm in diameter. All right. Nuclear pleonomorphism and mitotic rate both scored low, indicating low-grade tumor features. Tumor focality, unifocal, meaning there is a single area of cancer within the breast. Right? So, looking at it with a non-trained eye, she having no medical training, the AI is explaining a lot to her that she might not just be able to pick up looking at that report and all those complex terms, which I'm even having difficulty pronouncing. But the AI is able to tell her that a single area of cancer was found in the breast, 7 cm in diameter. Right? Lymphovascular invasion present, indicating that cancer cells are found in the lymph or blood vessels, which suggests there could be a potential for spread. Right? She's learned something else now, that there's a potential for spread in the cancer that was identified. The third image, or the third sheet of paper that she was able to take a photo of with a phone and upload to the AI, attach to the AI. Alright, so this implies that the cancer is hormone receptor positive, but HER2 new negative. Alright? I think these are terms that describe the kind of cancer. They are HER2 negative cancer cells. Right? Something like that. We could ask the AI to explain a bit more on that later. The fourth image, as the last image, it says tumor size more than 2 cm but not more than 5 cm. Right? So spread to 1 to 3 axillary lymph nodes. General recommendations. Remember, she wanted some recommendations of how she could stay healthy and beat cancer. So the AI gives her here general recommendations to stay healthy and improve outcome after breast cancer diagnosis. Here are some recommendations. 1. Follow-up care. Regular follow-ups with your oncologist and other healthcare providers. Adherence to prescribed medical therapy, like including hormone therapy if indicated. Healthy diet. Eat a balanced diet rich in fruits, vegetables, lean proteins, and whole grains. Right? She could even ask this AI to suggest some meals for her, which I'll show you how that could be done. Reduce intake of processed foods, red meat, and alcohol. Maintain a healthy weight is crucial. This advice here, I could just tell you, reducing intake of processed foods, red meat, and alcohol, especially red meat. A number of persons would have told her, right? Those were old timers that she would have sought advice from, to just told to reduce or eliminate meats, right? Proteins from her diet, right? And go vegetarian. Well, some sort of like that is what the AI is advising her here, to reduce intake of red meat. Of course, she would back this up, try to see if her doctor would support that advice there. Exercise. Engage in regular physical activity. Aim for at least 30 minutes of exercise these 30 minutes of exercise most days of the week. Activities may include walking, yoga, or other moderate exercises tailored to your ability and medical advice. Avoiding tobacco. If you smoke, seek assistance to quit smoking. Avoid secondhand smoke as well. Stress management. Practice stress reducing activities such as meditation, mindfulness, or leisurely hobbies. Consider joining a support group for breast cancer survivors. Monitoring. Watch for any new symptoms or changes. Report these to your healthcare provider promptly. Screenings and tests. Regular screenings such as mammograms and physical exams are recommended by your healthcare provider. Medication adherence. If on hormone therapy or other medications, ensure you take them as prescribed. Remember, staying proactive in your health and wellness strategy is key. Consult with your healthcare provider for personalized advice tailored to your specific medical condition and treatment. So this AI app gives the patient responsible advice. Doesn't say, trust me alone and let me take care of you, don't ever talk to your doctor again. It does not say that. encourages the patient to, that's why doctors should support it. It encourages the patient to consult with your health provider, that's the doctor himself or herself, for personalized advice tailored to your specific medical condition and treatment. So, because the AI is able to give such responsible kinds of advice, doctors, aside from its terms of use, right, which also encourages the patient to consult with a doctor, this AI is something that works with the healthcare system in Guyana or any other country in which a patient is able to use it. Right? So let me do a follow-up question on that she could say like, she could say something like, your advice on dieting is good. Can you suggest a breakfast, snack, and lunch menu for me today in line with my condition? Right? So the AI was able to tell her the kind of diet that could support her condition, but remember, she might need a little more specifics than, eat fruits, eat vegetables, and the AI is here for her. It is able to suggest to her some meals that she might use to in line with her medical condition. So with this AI, it's like if she has a expert on cancer, able to tell her what to eat this and that day, even suggest meals to her in line with its knowledge of how to improve her condition since she has breast cancer. So the AI says, certainly here's a healthy meal plan for your day that includes breakfast, a snack, and a lunch. Breakfast, oatmeal with berries and nuts. Ingredients, half cup rolled oats, 1 cup almond milk or low fat milk, half cup mixed berries, 1 tablespoon chia seeds. Right? She might be able to get all these from Massey. Right? Instructions, even gives her some instructions. Cook the oats in almond milk as per package instructions until they reach a creamy consistency. Mix in the chia seeds, top with mixed berries and nuts, drizzle with honey or maple syrup if desired. See? So does the patient get this when they visit, let's say, the Cancer Institute? Does the patient get this kind of assistance when they visit GPHC after they would have taken their breast off and now have to live with cancer? So a doctor who wants to give his or her patient more than the minimal that they can give, given their circumstances, having so much patients to deal with, can't spend so much time with one, can't really get too personal. The doctor who recognizes those limitations in his or her health assistance to the patient is likely to support this AI. Support the AI because it can do so much this doctor can't. If the doctor really and truly is interested in the patient's health and well-being and outcome as a cancer survivor. Morning snack, yogurt with fruits. Ingredients, 1 cup low-fat yogurt, half sliced banana or any other fruit of your choice, 1 tablespoon flaxseed or pumpkin seeds. Instructions, add sliced banana to the Greek yogurt. Sprinkle with flax seeds or pumpkin seeds for extra fiber and omega-3s. Lunch, grilled chicken salad. Ingredients, 1 grilled chicken breast, mixed greens, half avocado slice, half cup cherry tomatoes, half cup cucumber slice, half cup bell peppers, 2 tablespoons feta cheese, dressing, olive oil, lemon juice, salt and pepper. Instructions, well, there are the instructions here again. And even tips for preparing your meal. Balanced nutrition, focusing on incorporating a variety of fruits, vegetables, lean proteins and healthy fats. Include whole grain like oats for breakfast to keep you healthy, full and energized. portion control, pay attention to portion sizes, especially with higher calorie items like nuts and seeds. Stay hydrated, drink plenty of water throughout the day. You can also include herbal teas or infuse water with lemon or cucumber. Listen to your body slowly and mindfully, paying attention to how your body signals hunger and fullness. By choosing nutrient-dense and balanced meals, you can help support your overall health and well-being, which is important during cancer treatment. However, be sure to consult with your healthcare provider or nutritionist for personalized advice that takes into account your specific medical needs and conditions. Right? So once again, the AI is giving balanced advice to the patient. And of course, in terms of advice that takes into account your specific medical needs or conditions, the patient would have shared this report. But always remember, when she's asking for meal advice and so on, she could add some personal information about her. She herself, like, I'm allergic to this, or I'm allergic to nuts, or please omit salt, or please omit cayenne pepper, something that she does not like. So she could personalize her request for nutritional advice or meal preparation ideas as much as she wants, and the AI will suggest what would be most helpful for her during her cancer treatment. So that's our demonstration today using another Balwant Singh printed report with patient consent, enabling you, the viewer, to understand that this AI can handle all medical lab results and really be an asset in the hands of both patient and doctor.
As seen in that video, the MyLabs AI app helps you understand your lab results better, enabling more informed discussions with your doctor and improve your health. So make MyLabs AI a key part of your personal healthcare plan.